Good morning. I'm joined today by Mel Mock, a mother and medical student here in Calgary, and of course our leader, Rachel Notley. I want to acknowledge that we're gathered today on the traditional territory of the signatories of Treaty 7, and I acknowledge the Métis people who share a deep connection with this land. The contracting out of community lab services to DynaLIFE has been an absolute disaster. After nearly 8 months since the transition, Albertans are not getting the service they deserve or the service they need. I hear from people every single day about the terrible experience they have had when they've needed or gone to have a lab test. Often it's about the long wait times to get a test and even the long wait times if they have an appointment. It's even worse if they don't have an appointment. I've heard from people who have had to wait all day, sometimes with young kids in tow, waiting for that test because there were no spots for urgent tests. At the same time, I've been hearing about errors happening at the labs. I've heard of tests that have gone missing, wrong tests performed, results being sent to the wrong or incorrect doctor. This system is absolutely unsafe. All of this leads to more delays and longer wait times as this mistake is rectified. People have to go back and sit through the whole thing again sometimes. Aside from these issues, we also need to consider the impact of these issues on physicians, healthcare workers, and the health system in general. Family medicine and pediatrics are already under immense strain. Now physicians are adding unpaid time to their day to track down lab results, check that everything they ordered was actually completed, sort out who that test is for when it wasn't even their patient, and who would want to practice in that environment. I want to be clear that I don't put the blame on the lab staff. They're just doing the best they can in a really terrible environment. And on top of this, they're dealing with patients that are in a highly stressed state. This disastrous lab situation is not only a major inconvenience for patients, it's really putting the safety of all Albertans at risk. It's contributing to the burnout of physicians, and it's taking a huge toll on the well-being of staff within the lab system. To share her recent experience at a lab, I'm going to turn this over now to Mel Mock.
Hi, I'm Mel Mock. I'm a new mother and a medical student here in Calgary. This past Tuesday, I had an appointment for lab work at 11:30 at the DynaLIFE golf location. I arrived on time and was told there would be a 45-minute wait. While I was there, I noticed no one was seen over the lunch hour, despite a full waiting room. I overheard patients calling the Tom Baker Cancer Center to cancel appointments, people needing to leave, but being torn because they had been waiting for months for their lab work. I also overheard a patient explaining that he couldn't afford to stay more than an hour for this appointment because the parking was too expensive at $8 an hour, so he needed to leave. There were also distraught older patients and their caregivers complaining of hunger because they were fasting. At one point, the receptionist replied to someone's concerns by dismissing them by saying, "Everyone here is fasting." The receptionist also began telling people that their appointments were not really appointments, but suggestions. The mood in the waiting room was palpable as people overheard the instructions given to new people who arrived and as people notified the staff that they'd be leaving. It was so bad that the waiting room began cheering for each person who was called in and actually seen. In the end, I waited for more than 2 hours for the lab draw, for which I had an appointment and paid $19 for parking. Meanwhile, the walk-in wait times were being quoted as more than 4 hours, but when I was seen around 2:30, there were still people waiting who had registered around 9. And this only includes my time spent at the lab. Booking these labs were also incredibly problematic. I needed cycle-specific labs drawn, so I was unable to book well in advance. And being a medical student and a new mom meant I'm unable to wait for more than 4 hours for a walk-in appointment. When looking to book online, I wasn't initially able to find an appointment within city limits. Banff was the closest available. The earliest I could book was early August. Luckily, somebody must have canceled their appointment the night before, and I was able to book it. Otherwise, I was looking into paying over $200 to ensure that my lab tests were done on the correct day. The entire situation is unsustainable, and it needs to be fixed immediately. If not, I'm worried that these barriers to timely access to healthcare will lead to delayed diagnoses and negative health outcomes for Albertans, including my own family, friends, and my future patients. Thank you.
Well, thank you very much for sharing your story, Mel, and thank you, Luanne, for being here and raising this important issues. You know, we've heard so many similar stories of delays and cancellations and endless frustration with getting the most basic of lab work done. And this has been going on for months across Alberta, and the most devastating accounts we've heard about with respect to these lab service failures are right here in Calgary. But it didn't have to be this way. In fact, the lab system we have today is entirely the design of the UCP. Back when we were in government, when the NDP was in government, we asked the Health Quality Council of Alberta to study and to make recommendations about the best way to deliver good quality lab services to Albertans across the province. They concluded that a public system was in the best interests of patients and of taxpayers, and we were actually well into the process of building a public lab service, a center of excellence, a leading place that would have been one of the best of its kind in Canada and North America, when the UCP took power and, in a decision against public delivery of healthcare, chose to cancel it. They then handed the entire system over to a company that we can see very clearly is not up to the task. And the folks paying the price for that mismanagement are regular Albertans who are just trying to take care of their health. And the UCP in the meantime has done nothing to fix it. And now we're also here today to reveal that DynaLIFE itself appears to be admitting that their approach is failing Albertans. Just last week, we discovered lobbying records from earlier this year that show that DynaLIFE is openly discussing the possibility of the provincial government, wait for it, buying back the whole lab system once again. A portion of their lobbying records state specifically that part of what is being explored is, quote, the option of acquiring DynaLIFE and integrating it back into AHS operations. We'll be distributing those records with our news release to the media today. But that's right. After wasting tens of millions of Albertans' tax dollars or more to blow up the public lab, the UCP gave the whole thing to a private company who now wants taxpayers to buy it back from them. Meanwhile, even more importantly, regular Albertans are left with unacceptable wait times and frustrations. These are the pressures that push people towards those clinics we've been hearing about over the last few days that are offering faster access in exchange for thousands of dollars in annual membership fees. Clinics in Calgary, for instance, such as Harrison Healthcare, explicitly offer a, quote, on-site laboratory and assessment center, but you have to pay $5,200 out of pocket to be able to use it. If you don't do that, well, then you can go sit in one of the waiting rooms we've just heard described and hope that somebody at DynaLIFE will get your test done. That cannot be how we provide healthcare in Alberta. Right now, Danielle Smith and Adriana LaGrange need to stop clinics from charging membership fees, and they need to enforce the contract with DynaLIFE. And DynaLIFE is not holding up their end. Albertans are not getting what they paid for, and there must be consequences for that. But fundamentally, every single Albertan must have timely access to a doctor, and they must have timely access to the important tests that those doctors order and rely upon in order to deliver
the best treatment possible for Alberta families. So it is time to end the crisis in healthcare, and that includes the crisis created by the UCP in our lab system. And it is time to stop forcing Albertans to pay out of pocket to get the public health care that they deserve. So thank you, and we're happy to take any questions you might have.
Okay, we'll start with questions in person, then go to questions on the line.
From as long as I can remember as a child, there's always been long wait times in the emergency room. Is these long wait times at the labs new, or is it just like?
No, so the wait times for labs have gone up considerably, specifically since the government has transferred public and community lab services from the public lab service that we had in Alberta to DynaLIFE to run it. And it's been particularly bad in Calgary. So that's a new thing. It's not something that we used to have to deal with. Mm-hmm. Pardon me? Yeah.
Hi, I can say that I was doing a lot of lab work for some health reasons probably about a year and a half ago, 2 years ago, and I was getting it done fairly regularly. And then I went back recently to get my lab work done just this week, and it was like night and day, and it's a completely different system. I feel like before, you know, it'd be a 15-minute wait if somebody was kind of running behind, and this was more than 2 hours.
Okay. Do we have any statistics on maybe the year when it started and maybe the rise that we've seen?
I don't know that we've got clear statistics yet, but it did just only start about 9 months ago when the formal transfer from Alberta, the AHS-run labs, directly to DynaLIFE, taking over the full community labs.
Okay, we'll now go to questions on the line. Just a reminder, if you're joining by phone, to use the *9 function, and if you're joining by Zoom, to raise hand function. We'll go to our first caller. Go ahead, caller. Your line should be open there.
Hey, it's Tim Brook with CTV. You kind of poked at a solution there, but I want to know how we fix this long term and what happens if we don't fix this.
Well, I think, let me start, first of all, that if we don't fix this problem, the ability for people to get quality public health care will be fundamentally compromised. Doctors, family doctors, specialists, all kinds of caregivers rely on testing in order to help them determine what is the best treatment for their patients. And so if we can't get regular testing, you know, we're asking our physicians to make guesses, and that's not how healthcare is delivered. So this is a fundamental component to our healthcare system. My view is now and has always been that lab services are best offered both, you know, obviously publicly funded, but also publicly delivered. And that way you can coordinate and be as efficient as possible. And unfortunately, the UCP, having made an ideological decision that they don't like public delivery, has created a great deal of chaos in the system over many years, and this is the latest and I would argue most extreme version of it.
Is there a follow-up?
Yeah, an unrelated follow-up. I'm just hoping to get your comment on the current RRO, the energy rates. We're set to reach a record high next year. The province has talked about eventually phasing out this RRO. What would an NDP government do, and where along the lines did we go wrong as far as these high rates in Alberta? Because it's, you know, it's high in other provinces, but we're definitely feeling it pretty heavily here.
No, that's absolutely true, and this is unfortunately the product of I would argue some pretty serious mismanagement on the part of the UCP. And you know, we had a cap in place when we were in government. The UCP made a decision to take that cap off. The prices went up. At the same time, they said to Albertans, we're going to let the private market decide how things work out, and you as consumers of this necessary product, i.e. a utility, are going to have to figure it out on your own and figure out where to get the best deal or not to get the best deal. On top of that, there was no provision made for those consumers who are lower income, who have more uncertain financial circumstances, who are unable to negotiate the best deals. And so as a result of that, those folks are completely being left out in the cold this summer, ironically, and they're going to end up having to pay so much that they are really going to struggle to put food on the table for their families, and that's wrong. So the answer is to make sure that on a short-term basis to stabilize prices for folks who are still on the RRO, and then to come up with a stronger, longer-term, more stable means of pricing our utilities here in the province of Alberta.
Any other questions, Tim?
Nope.
Okay, do you want more pass for questions either on the line or in person? Oh, Dean Bennett, go ahead.
Oh, good morning, Rachel. Hope you can hear me.
Mm-hmm.
So I'm just doing a quick read of these of the primary documents that you were referring to. So it looks like this was filed in February.
Yep.
And the previous 6 months talked about, perhaps looking at AHS taking DynaLIFE in-house. And then it says description of next 6 months. It doesn't mention that. So how do you read this? How recent is this? Sorry, and what's going on here?
Well, again, I mean, these documents are not, they choose what to put into their description. But certainly what we are hearing is that there is a great deal of friction between DynaLIFE and AHS because, of course, DynaLIFE is not delivering on the level of service that they promised when the contracts were signed. So I believe that all solutions are still being discussed, and that there's a very good chance that we're going to be looking at some version of taxpayers having to bring all or part of this back into the public system. But unfortunately, in the course of doing that, we're all living through a whole bunch of chaos right now, and taxpayers are going to have to pay more. And we are so far behind where we would have been had the UCP not ripped all this up 4.5 years ago and created the chaos that we're living with now.
Is there a follow-up, Dean?
Yeah, so if this proceeds as we talked about, so we give them the contract and then they butcher it to the point that we have to actually pay them to take it back from them? I mean, is there a way we can get a good deal out of this?
I'm not at the table, so I can't tell you the details. I think that we've already, the idea of getting a good deal, that horse has long since left the barn. Albertans are paying too much for too little because of UCP mismanagement. And the question now is how much more are we going to have to pay to get to the point where we have a reliable, fundamentally accessible and high quality lab service so that we can continue to receive the kind of health care that we've all come to appropriately expect.
Any other questions there, Dean?
Yeah, just one other one on, I don't know if you saw George Tahal's comment. He doesn't think the Stampede has delivered a proper apology for what happened in the lawsuit, and he wants to withhold federal funding to the Stampede until that happens. What do you think?
Well, let me start by saying that my heart goes out to the at least 70 victims who have signed on to the class action lawsuit and their families. I am appalled and quite honestly was not aware of the scope of this problem. 70 people over more than 2 decades. So I share Mr. George Tahal's concerns, but I think there's bigger questions here. The Calgary Stampede has enjoyed funding and support from every level of government. It's enjoyed funding and support and the volunteer time of community groups and individual Albertans and Calgarians for years. And quite frankly, we all deserve to know in considerably more detail with a much higher level of transparency who knew what when at the Calgary Stampede Board. 70 people in this class action is not a one-time event over 2 decades. So there's a very serious concern here, and the community, which is so integrated with the Stampede, deserves to know exactly what happened.
Okay, any other questions, Dean, or are you good?
I'm good. Thanks very much.
Thank you.
All right, that's all for today.